A very good morning to all of you. Today we will begin with psychiatry portion. So let us begin with the first question. Which of the following is not associated with dementia? Now, what exactly is dementia? We should know what exactly dementia is in order to solve this question. What happens in dementia? Forgetfulness is there, reduced personal care is there, loss of neurons is there, forgetfulness is there, reduced personal care is there, loss of neurons is there. Now, what about alteration of consciousness? Alteration of consciousness is in delirium, it is not in dementia. Alteration of consciousness is in delirium, not in dementia. So, the correct option here is alteration of consciousness. Which of the following is not associated with dementia? Forgetfulness, reduced personal care, loss of neurons in brain, all are there except alteration of consciousness. Alteration of consciousness is seen in delirium, not dementia. A well-dressed man came for feeling of woman trapped in a man's body is suffering from A. Paraphilia, B. Transvestism, C. Gender identity disorder, D. Frotteurism. Now let us look one by one what it is. This person is a man, but he is feeling that he is a woman trapped in man's body. So it is a he cannot identify himself with the he is identifying himself with the other sex. So it is gender identity disorder. Gender identity disorder. Now, what is gender identity disorder? Can anybody tell in the chat box, please? What is gender identity disorder? Can anybody tell in the chat box, please? Folie deux means A. Delusion of persecution, B. Sharing of delusion, C. Delusion of double, D. None. Delusion of double, D. None. Folie deux means sharing of delusion. Folie deux means sharing of delusion. Now, what is sharing of delusion? It is also known as shared psychotic disorder. It is also known as symbiotic psychosis. Symbiotic psychosis. It is characterized by sharing of delusion between two persons, known as polydux, or rarely between more individuals, also known as polytrois. In this, there is a dominant person or active person who induces delusion into the other person, who is a passive person. Passive person or receptor or dependent person. The dependent person accepts the delusion of a dominant person. The dependent person accepts the delusion of dominant person. On separation of two, the dependent personality may give up his delusion. But, however, the active or dominant person often requires the treatment. So, polydex means sharing of delusion. REM sleep is associated with all. REM sleep is associated with all. A. Dreams. B. Delta waves. C. Muscle tone. Delta waves, muscle tone. muscle tone, increased BP, increased BP, increased BP. See, delta waves is seen in deep sleep, not in REM sleep. So the correct option here is B, delta waves. Ataxia abasia is seen in A, conversion disorder, B, post-traumatic stress disorder, C, depression, D, mania. Ataxia abasia is seen in conversion disorder. So the correct option here is A, conversion disorder. Not used for erectile dysfunction. Now, which are the drugs which are used for erectile dysfunction? Tadalafil, Tadalafil is there. Sildenafil is there. Sildenafil is there. PGE analogs are used. Papaverine is used. Beta blockers are not used for erectile dysfunction. Beta blockers are not used for erectile dysfunction. So the drugs used for erectile dysfunction are phosphodiesterase 5 inhibitors, that is sildenafil, tadalafil, vardenafil. They inhibit PDE5, phosphodiesterase 5. These drugs prevent degradation of CGMP, and potentiate the action of NC. These are the drug of choice for pharmacological therapy of erectile dysfunction. Then alprostadil, that is PGE1. Alprostadil is a powerful vasodilator. It acts by increasing arterial flow by vasodilatation and reducing outflow by contracting the corporal smooth muscle that occludes, draining the venues. It is a drug of choice for patients not responding to PD5 inhibitors. PD5 inhibitors. It is directly injected into corpora cavernosa. It is directly injected into corpora cavernosa, alprostadil. Then comes papaverine. Papaverine is a non-specific phosphodiesterase inhibitor. Injection of papaverine with or without phentylamine into corpus cavernosum produces phenyltuminins to permit intercourse. Repeated injection can cause penile fibrosis. Repeated injection can cause penile fibrosis. Androgen, Androgens can be used when androgen deficiency is demonstrated to be responsible for loss of libido and erectile dysfunction. Apomorphine. Apomorphine is a dopamine antagonist. Is given by subcutaneous injection. Apomorphine. So beta blockers are not used. All others are used. So the correct option here is A, beta blockers. A student unable to deliver a speech before the audience is suffering from. Student unable to deliver the speech before the audience is suffering from A, social phobia, B, OCD, that is obsessive compulsive disorder, C, agoraphobia, D, claustrophobia. Here it is social phobia. Now what is phobia? What is phobia? Phobia means fear. Phobia means fear. What are the different types of phobia you know? What is agoraphobia? What is claustrophobia? Claustrophobia is fear of closed spaces. What is phobia? Phobia is a persistent, this word is important, and morbid fear of a specific situation, object, or activity. It is a persistent and morbid fear of a specific object, situation, or activity. The fear is morbid because the fear is irrational. The object or situation do not produce fear in normal person. Fear is irrational. The fear is out of proportion to dangerousness perceived. Fear is out of proportion. Patient is unable to control the fear and is very distressed by it. Now, agoraphobia means irrational fear of situation. It is the commonest type of phobia encountered. Irrational fear of being in places away from familiar setting of home, and patient believes that he cannot escape from these places to a safer place, usually the home. It is agoraphobia. So the correct option here is A, social phobia. Suicide is most common in A, depression, B, alcohol dependence, C, dementia, D, schizophrenia. Suicide is common in, most common in. We all know the correct option here is depression. Depression. So the correct option here is A, depression. Which of the following can cause delirium? Hypoxia can cause delirium, barbiturate can cause delirium, alcohol withdrawal can also cause delirium. So the correct option here is D, all of the above. Pyromania. Pyro means fire, mania means setting things on fire. Pyromania refers to an irresistible urge to A, set things on fire. Other options are B, eat out of proportion, sleep for long periods, D, none. So the correct option here is A, setting things on fire. The delusion which involves replacement of a familiar person by someone else is Capgras syndrome or delusion of doubles. Involves replacement of familiar person by someone else. Code Hank means A, passive partner in sexual intercourse, B, woman having high sexual desire, C, sexual partner in pedophilia, D, male important to particular woman. So code Hank means male important to a particular woman. Pagophobia involves eating of A, ice, B, sand, C, clay, D, salt. So the correct option here is A, ice. Pagoph- Pagophagia means involves eating the ice. Doppelganger is A, shadow of following person, feeling of double of oneself, identification of stranger as familiar, D, none of the above. It is feeling of double of oneself. What is contraindication for ECT? The contraindication for ECT is cerebral aneurysm. Which of the following is a delusion? A, Othello syndrome, B, de Clerambault syndrome, C, pyromania, D, none. It is Othello syndrome. Othello syndrome is a delusion. Child wakes up at night. He wakes up at night, sweating and terrified. He does not remember. He does not remember the episode diagnosis. Option A, narcolepsy. B, nightmares. C, night terrors. D, somnambulism. So the correct option here is night terrors. Night terrors. Night terrors. What is night terror? The patient does not remember what has happened. Patient does not remember what has happened. It is night terrors. If the patient remembers what has happened, it is nightmares. Flooding is a treatment modality used in A, phobia, B, depression, C, mania, D, schizophrenia. A, phobia, B. Depression. C. Mania. D. Schizophrenia. It is phobia. Borderline personality disorder. Borderline personality disorder. A. Chronic feeling of emptiness. B. Unstable interpersonal relationship. C. Grandiosity. D. Low self esteem. Borderline personality disorder is a chronic feeling of emptiness. B. Unstable interpersonal relationship. C. Grandiosity. It is unstable interpersonal relationship. The person who have this borderline personality disorder may have unstable interpersonal relationship. Indications of ECT are all. Indications of ECT are all. A. Severe depression with suicidal risk. B. Catatonic schizophrenia. C. Severe psychosis. And D. Severe maniac attack. Psychoanalysis was started by A. Eugen Bleuler. B. Sigmund Freud. C. Bleuler. D. Erikson. Psychoanalysis was started by whom? Sigmund Freud. Sigmund. So the correct option here is B. Sigmund Freud. Cotard syndrome. Cotard syndrome. Nihilistic delusions. All are features of Korsakoff syndrome. A. Antegrade amnesia. B. Retrograde amnesia. C. Ataxia. D. Confabulation. Korsakoff syndrome. What are the features of Korsakoff syndrome? What is the other name of Korsakoff syndrome? What is confabulation? So such type of questions can be asked as MCQ. So we must know everything about the Wernicke-Korsakoff syndrome. What is confabulation? Can anybody? Confabulation. Type in the chat box, please. Confabulation. What is confabulation? Let us look what the correct option here is. Ataxia. Ataxia is not seen in Korsakoff syndrome. Suspiciousness is a characteristic feature of A. Paranoid personality disorder. B. Schizoid personality disorder. C. Schizotypal personality disorder. D. Anacastic personality disorder. Suspiciousness is a characteristic of Suspiciousness is a characteristic of paranoid personality disorder. Paranoid personality disorder. Now, what is a paranoid personality disorder? Can anybody comment in the chat box, please? Paranoid personality disorder. What do you mean by a paranoid? Paranoid personality disorder is characterized by generalized mistrust. There is a generalized mistrust is there. Suspiciousness is there about the motives and actions of others. There is a generalized mistrust is there. Suspiciousness is there about the motives and actions of others, and a tendency to interpret them as malevolent. Malevolent. The patient believes that others are exploiting or deceiving the person. Exploiting or deceiving the person. Friends are untrustworthy and not loyal. The spouse is unfaithful. There is a hidden meaning in neutral or friendly remarks. Many patients have feeling of self-importance and think they are unusually talented. So there is a generalized mistrust is there, suspiciousness is there about the motives and actions of others. The patient believes firmly that others are exploiting or deceiving the person. The patient believes that friends are untrustworthy and not loyal. The spouse or partner is unfaithful. There is hidden meaning in neutral or friendly remarks. The patient have feeling of self-importance and think they are unusually talented. It is seen in paranoid personality disorder. All are symptoms of morphine withdrawal. Morphine withdrawal. Except now, what are the symptoms of morphine withdrawal? Here they given mydriasis. Yes, of course, mydriasis will occur. Yawning will occur. Lacrimation will occur. No, fall in BP will not occur. There will be a rise in BP. Rise in BP. So the correct option here is D. Fall in BP. What are the different types of delusions you know? Delusion of grandeur, grandiose delusion, delusion of reference, persecutory delusions, persecutory delusions. What are the indications of ECT? The indications of ECT are severe depression with suicidal risk, catatonic or paranoid schizophrenia, schizophrenic or depressive stupor, severe catatonia with stupor, severe psychosis with risk of suicide or homicide or physical assault. So indications of ECT are severe depression with suicidal risk, some different types of schizophrenia, catatonia or paranoid, schizophrenia or depressive stupor, severe catatonia with stupor, severe psychosis. Severe psychosis. Delusion of jealousy, delusion of jealousy, delusion of love. This delusion of love is more prevalent among females, and there is an erotic conviction that a person with higher status is in love with the patient. It is also called de Clermont syndrome. De Clermont syndrome. Delusion of jealousy. Content of delusion is predominantly jealousy, that is, infidelity about the spouse, also called Othello syndrome or conjugal paranoia. Elaborate steps are taken to prevent the spouse to go outside. He locks the spouse, not allowing her to go outside, or to catch the spouse red-handed by using private detectives. This is Othello syndrome or congenital conjugal paranoia. Then delusion of grandeur. Delusion of grandeur means delusion of inflated self-esteem and self-image. The patient may believe that he is an important person who is able to help others, or may report hearing the voice of God and saints, confirming their elevated status. Then delusional dysmorphobia. Then delusional parasitosis. Delusional parasitosis means infestation by worms or foreign body. Then delusional halitosis means emitting a foul odor. Foul odor. Then hypochondriac delusion. There are delusion related to patient's body or its part. The condition is also referred to as monosymptomatic hypochondrial psychosis or hypochondrial paranoia. So these are the different types of delusions. Now what happens in dementia? Dementia is a chronic onset disease. There is no disturbance of consciousness. Cognitive impairment is there, personality alteration is there, impaired memory is there, impaired judgment is there. Absent diurnal variation is there. Absent. So with this, we finish with psychiatry today. I wish you all the best. We will meet again today in the evening at 9:30 p.m. Prepare well for the NEET PG exam or the national exit test. Thank you.